Hi, everybody. Thank you for joining us today. My name's Jennifer Harrod. I'm the breast nurse navigator with Project 31.
I'm Jane Wilson, CFO and breast cancer survivor with Project 31.
Yes. And today we're going to talk about early detection and screening for breast cancer. I know for myself, thank goodness I had early detection and screening.
I didn't.
Yeah, I was blessed. We started young due to my family history. So I feel very blessed that they caught mine so early. And it's so confusing, I think, there's so many different guidelines out there. So which one do you follow? Which one's right? Well, really, it's going to be up to your doctor and your insurance company to kind of know what guidelines they're going to cover.
Well, like you said, your family history will drive a lot of that.
Huge. And, if you have a high family history, we'll kind of get into this, then you're going to be at high risk. So you change from the average everyday person that has no family history, that does not have a genetic mutation in their family. So first off, I think mainly the two we're going to talk about are American Cancer Society, which is ACS, and the National Comprehensive Cancer Network, which is also abbreviated as nccn.org is the website. Two terms that I want to start out with also are breast self-awareness. So it's kind of a newer term.
Okay.
The American Cancer Society no longer recommends that women perform monthly breast self-exams.
I wonder why.
Yeah. And, NCCN does not go with that guideline, but American Cancer Society does. They believe that women should be familiar with both the appearance and the feel of their breasts and report any changes to their doctors.
Okay.
So in a sense, it's about the same. I mean, you can still do those monthly breast self-exams, but if you notice any lump or any other symptoms that develop, contact your doctor immediately. So that's when you hear me talk about breast self-awareness, that is what I'm referring to.
And so the way you're going to be self-aware about your breast is to, touch it and feel it and different times of the month, depending on your cycle.
Right.
They get bigger and smaller and all the things. But knowing what they feel like
Definitely
is key.
Or your spouse knowing what they feel like.
Or your spouse, if you have one, or a partner having,
Exactly.
But I think for me, I found my own lump. So a lot of women find their own lump. Right.
And that's just breast self-awareness, knowing what's normal, what's not normal. Yep. And even if it's, right after you've had a mammogram, if you notice a change, call your doctor. Don't wait. So.
Yeah, those tests don't always pick up every single thing.
No. I wish they did, but.
I wish they did.
And most women, if they're under 30, they're going to be referred for an ultrasound because women under 30, their breast tissue is so dense that it can hide things. So that may not be picked up in a mammogram. So they'll probably order an ultrasound. Yeah. There's also, you'll hear clinical breast exam, also abbreviated CBE. The American Cancer Society also no longer recommends this.
So that's your doctor doing it,
for
right?
For breast cancer screening in average risk women. Because of, and I had to research this and kind of why, but because of lack of clear benefits.
Interesting.
For clinical breast exam alone or in conjunction with mammograms. But NCCN guidelines still recommend it.
So that's going to be up to your doctor then, how they feel about it, whether there's benefit or assume, right? They have leeway either way.
Exactly. Depends on which guideline they're going by. And there are other guidelines out there too that I'm not discussing. Yeah. So according to the American Cancer Society, though, average risk is for women that don't have a personal history of breast cancer, that do not have a suspected or a confirmed genetic mutation, such as BRCA1, BRCA2. Sure. If they do not have a strong family history or a history of previous radiation to the chest at a young age, because women that maybe at a younger age might have had another cancer, they would have had radiation to their chest.
That makes sense.
Yeah, so that if you fall into those categories, then you're going to be at a higher risk.
Right. So it moves you from average to
higher risk.
Okay.
Correct. So according to the NCCN guidelines, if a patient is over 25 years of age but under 40, then and at average risk for breast cancer, then a clinical breast exam is encouraged every 1 to 3 years, as well as just breast awareness. So, like we said, knowing what your breast looks like, feels like, and having a clinical breast exam by a doctor. So that's at an average risk. According to the American Cancer Society, women should have the opportunity to begin annual screening between the ages of 40 and 44. So NCCN guidelines are if a patient is over 40 and at average risk, then they should have an annual clinical encounter with their doctor and annual screening mammograms. So that's starting at 40 years of age, annual screening mammograms. And they recommend a digital mammogram with high resolution if that's available.
Right. And my clinic has been offering those for years now. For the longest time, they cost extra. I'm not sure they cost extra anymore. I don't remember getting charged for that lately.
I think more insurances are starting to cover it. Back whenever mine was found, it was still an extra, I think, $80.
Right.
And to me, I was like, sure, go ahead.
But for some people, that's prohibitive. Exactly. You know, I think mine was more than that. But because of my history, I'm like, oh, no, I want the best picture possible. Like, if we're going to show up for this, let's get a good shot.
Exactly. Especially if you have high, dense breast tissue and a high risk. It's like seeing, one tree in a forest. It's hard to see unless you have good resolution.
Right.
So, now, ACS, American Cancer Society, also recommends women 45 to 54 should be screened annually by a mammogram. Okay. And then women ages 55 and older can transition to every other year screening, or they have the opportunity to screen every year if they would like.
If they want. I think if you really pushed for it, your doctor would obviously do it.
Yeah.
But I know for me, a couple of years ago, I think I went to every other year.
Did you?
Statistically, but because of my history, my doctor still wants me to see every year. So, because we had that conversation, he said, now, you're eligible for every other year because of your age. But he said, I still want you looked at. So,
yeah, which is great. I mean, better to be proactive on it.
I don't mind.
No. And then women should continue having a mammogram as long as their overall health is good and they have a life expectancy over 10 years.
Okay, that makes sense.
So that's what they recommend. And I know for myself, I've had a double mastectomy with reconstruction. I don't do mammograms. So I do the clinical breast check by the doctor.
So I had a partial mastectomy. So my other breast is still whole.
Right.
And this one is probably 60% my breast, original breast. I had a lap flap. So some of it's from my back, some of it's from my front, you know, so it's all over the place. But I still have quite a bit of breast tissue. So
you still do them. And a lot of women ask, okay, I've had a mammogram or I've had a mastectomy. Now what? You know? So they're still going to be watching you.
Because you can get breast cancer way over here. And like they would not have gone this far over with the mastectomy. Yeah. Like you could have sometimes that happens where you'll have a breast cancer way over here. It's still breast tissue, but it's not what was removed in a mastectomy.
Right.
So that's when knowing your
what
body,
you feel like, yes,
is hugely important.
Definitely.
Because a mammogram wouldn't pick that up anyway.
Probably
not way over there.
And there's, even though they say they're getting all the tissue with a mastectomy, they don't.
No, they don't. They can't.
No, there's no way. Still have some in the chest wall. So, yeah. Now, high-risk women, of course, we talked about their screening being a little bit different. So, when they say high risk, if an average lifetime risk is over 20,
Okay.
And they normally, the doctors and the screening facilities will give you what your average risk is. If they're over 20, then a clinical encounter every 6 to 12 months to begin when identified as being at the increased risk.
Okay.
Okay. But not prior to age 21.
Interesting.
Yeah. So they also, if you're at average risk over 20, they recommend seeing a genetic counselor as well.
I can see that.
Yeah. Also, you may consider a referral to a breast specialist if that's appropriate, if you're at high risk, so they can monitor you closely. Annual screening mammogram, of course, higher resolution, digital if possible, and to begin 10 years prior to when the youngest family member was diagnosed with breast cancer, not prior to the age of 30 years old, or begin at 40, whichever comes first. That's when you start.
So I was diagnosed at 40. So my daughter started having mammograms at 30, 31, something like that, which normally she wouldn't have, obviously, but because it was me.
Family history.
Yeah, family history. So so she's had several. Today's her birthday, actually.
Oh, wow.
And so
Happy birthday. Happy birthday.
She's had several in the last 10 or 11 years. She's gone annually because that's what you need to do.
Knowing your family risk is important.
It is.
An annual breast MRI to begin 10 years prior to when the youngest family member was diagnosed with cancer is also another recommendation from the American Cancer Society. And may consider enhanced mammography or whole breast ultrasound for those who qualify but cannot undergo an MRI.
Yeah, and I will say my experience with getting MRIs approved through insurance, pretty tough.
Yeah.
Even with my personal history, I still have to pay for MRIs. I have never had insurance cover an MRI.
Which is sad in this day and age.
Isn't it? So I cannot imagine that if you just walked in and said, I want an MRI because my mom had breast cancer, I cannot imagine. You'd have to have really good insurance for that.
Exactly. Or you would be paying for it.
Or you pay for it. And listen, if that's what you need for peace of mind, I would say save up for it.
And do it. Another recommendation, if you're at high risk, is the doctor would talk to you about risk reduction strategies and what they have. And then, of course, breast awareness of what your breast is like if you notice anything. So there are additional recommendations from American Cancer Society. So if you're at age 30, annual screening with MRI in addition to mammography is recommended for women with an estimated lifetime risk of breast cancer of at least 20 to 25%. So, of course, your doctor, your screening facility would be able to tell you what your average risk is. There's also women estimated with a 15 to 20% risk, lifetime risk, should talk with their doctors about the benefits and limitations of adding MRI screening. But if a lifetime risk is at 15% or less, studies indicate that MRI is not needed.
Right. And, I had that conversation with my doctor. I said, why are they not screening the daylights out of me all the time? Why is that not a thing? Because I had pretty advanced breast cancer. And he said, you've got to analyze the benefits of all that radiation in your body, the risk of all that radiation versus the benefits of finding something. And so they don't want to just put you through that MRI machine all the time, or a PET scan or a CAT scan and all the different scans that you can have. And that didn't make sense to me, but did make sense to me. They're trying to protect you from other things. They've got to consider your whole body, not just breast cancer. So the potential damage to your heart and lungs, or the potential damage to other body parts, depending on
other cancers.
Other cancers. It's not just it's not like taking a photograph. Right. There is risk there. So once he explained that to me, I said, okay, well then I'll calm down,
But it is scary when you've had breast cancer. You have a high risk of breast cancer. Why are you not doing these screenings?
Right. It seemed simple.
Yeah.
Seemed like a simple answer. but it's not that simple.
No. And especially if insurance doesn't pay for it.
Yeah, then it's expensive too.
Mm-hmm. So if you can do the same benefit as doing your self-exam yourself, knowing what your breast tissue feels like, knowing after a mastectomy what your chest wall, what your body looks like and feels like, and just if you notice something unusual, because I noticed one year, why am I having this pain? Why am I feel some lumps, some bumps that are a little bit different. So I contacted my doctor. They ordered an ultrasound. We went in and did that.
Mm-hmm.
Still having issues. I went in and did an MRI at that point because insurance would cover it.
Yeah.
Praise the Lord.
Nothing.
It was just scar tissue,
So it's good to know. It relieves your mind.
Yes.
I don't have to worry about that today. I had a similar kind of a thing. I had some stomach issues. So it's after all this chemo and after all this thing, I had just this kind of perpetual upsetness and just couldn't get rid of it. No matter what I did, no matter what I cut out of my diet, no matter what. And it was really early on, close to my chemo. And so I talked to my oncologist about it. I'm like, something's just off, just something. So he sent me for some scans and some things and determined there was nothing there. And that was enough to kind of, put my mind at ease and just make some changes in my lifestyle to kind of minimize that. And so I never have had trouble with that again. But knowing your body, this is new and it's different and it's not right, So taking that to your doctor and saying, do we need to have this looked at? And sometimes they'll tell you, sure, they'll run all the panels, they'll run all the things. They don't see anything weird. And they'll say, come back in 3 months, come back in 6 months. Sometimes that's the right answer too. So you've got to trust your doctor to help you with early screening of any kind of cancer, not just breast cancer.
Definitely.
Because we all know things can, go to some other part. You could develop lung cancer or bone or whatever. So if you, I've got this one little spot on my leg, but I think it's how I cross my legs when I sit. I think I've determined it's not cancer, it's how I sit. And so whenever it kind of flares up, I'm like, quit sitting like that, So just little things like that, because everything is potential cancer after you've had cancer, right?
Oh, yeah.
And every hangnail.
I'm telling you, I had a spot. I do skin exams with my dermatologist, and they found a spot that was, cancerous. So I had that removed.
Exactly.
So, I do my colonoscopies. I started that young.
Yeah.
So doing the regular screenings that you need to be doing.
You do need to do all that regular stuff and try not to be, overly zealous about every little hangnail. But
it's scary.
It's scary. It can scare you a lot. And I think that's normal. And so your doctors are used to that. I always felt like I'm not the first person who's called him and said this.
Nope. And you won't be the last.
I won't be the last. And they'll have a good laugh when they get off the phone with me. And they'll say, oh my gosh, that Jane, she's being a hypochondriac, but
who's not after breast cancer?
Oh my gosh, I never thought I would have breast cancer. So, so then it kind of stirs up all of that. But I do think the early detection, obviously the earlier you catch it, potentially the less treatment you have to have, right?
Exactly. And, praise the Lord, mine was caught early.
Right.
I did that extra step of the mammogram. I started a little bit early on my mammograms, but that's because it paid off, history.
Right?
Yes. So it was caught early. I had a double mastectomy. So it's really important to not miss a year on your mammogram.
Right.
To make sure you're going. If you do notice something different, ladies, even if you're younger, because there are younger and younger women being diagnosed with breast cancer.
Sadly.
So I think, starting at a younger age and being aware of what your breast tissue feels like and bringing that to your doctor's attention and advocating for yourself.
I think that's the key. For me, that's what I didn't do, was advocate for myself. When I was about 25, 26, 27-ish, I could feel, not tactily feel, but down deep, I felt like this pain. And so the classic answer is cancer doesn't hurt. Well, that is so not true. And I was told everything, because you could not feel it when you pressed, like it was so deep in there, you couldn't feel it. So they sent me for a mammogram, again, not knowing that mammogram is maybe not the best tool.
Right.
But that's kind of where they start. Anyway, nothing showed up, of course. And what I heard was, quit worrying about it. It's
Right.
nothing. Well, it wasn't nothing. It continued to grow. But it took 13 years for you to be able to. And as a matter of fact, ironically, that a month before I could actually feel it, I had been to my doctor, my OBGYN, for my annual exam. He couldn't feel it, So, I mean, just know your body. And I should have continued. I had many years there where I could have said, I need another mammogram.
Right.
I need an MRI. I need something. Look, I still feel this, right? I didn't do that. And so I felt like I was an inconvenience and that I was just being silly,
Right. And they'll say, well, you're 25 years old.
Exactly.
You're not going to get breast cancer. Yes, you can.
So now I know, yes, you can, because we have lots of young ladies that come to our group that are diagnosed in their 20s. So don't feel silly. Go, take care of yourself. And if your doctor won't listen, find a doctor that will.
Definitely.
Right? Find somebody who will listen to you. And again, don't let it be your leg thing. Figure out if it's cancer or not, right? It might be the way you're sitting, but probably not in your breast, right? but I mean, there's a balance there somewhere between I know my body or I'm being a little crazy, right? I'm being a little anxious, over anxious. And I do think it depends on your family history. If you have a family history of cancer, I mean, they told my daughter, I'd had breast cancer. My husband had prostate cancer. They said, you don't get to skip. You get to keep coming because you've got it coming from both angles. So it may not be necessarily breast cancer in your family history. Just be aware that those cancers, it's important to know your family history and
it is.
And let your doctors know your family history.
It definitely is. So hopefully this has been some good information for everybody to encourage you, go get those mammograms, know what your body is doing and what it feels like. So
thanks for joining us. Hope you guys can come back and see us here again soon.
Have a great day.